This video is about infection control in the acute spinal cord injury ICU. This is the acute spinal cord injury unit at Groote Hospital. Here, 24 nurses work in 12-hour shifts to give the optimum care to patients with spinal cord injuries. Patients are looked after by a multidisciplinary team consisting of physios, OTs, dietitians, social workers, and doctors. These are very vulnerable patients, and the ICU is very serious about infection control. The goal of infection control is to eliminate healthcare-associated infections. These infections lead to significant and additional healthcare costs, as well as creating drug-resistant organisms. The fundamental principles of infection control include standard precautions and transmission precautions. Let's look at standard precautions first. Standard precautions are applicable for all healthcare settings, no matter the infection status of the patient. The principle of hand hygiene includes clean, short nails and minimal jewelry. Any lesions on the hands should be covered with a moisture-resistant dressing or plaster, and gloves should be worn. Washing of hands with soap and water is of utmost importance. Alcohol hand rub can be used too. Personal protective equipment. Gloves are always to be worn when in contact with the patient's bed, or the patient's surroundings. It's important to remember, however, that gloves are not a replacement for hand hygiene. Respiratory hygiene. Cough or sneeze into disposable tissue and throw it away. Any vulnerable patients should be 1 to 2 meters away from anyone coughing or sneezing. Safe injection practices include the use of a new needle and syringe for every injection, never recapping used needles, and ensuring safe disposal of needles into a sharps container. Standard precautions are supplemented by transmission-based precautions when patients are suspected or known to be infected with a highly transmissible organism. There are 3 categories of transmission-based precautions. Contact precautions are used for all patients in the acute spinal cord ICU, but are mostly used for patients with MRSA, Clostridium difficile, E. coli, scabies, impetigo, and Pseudomonas infection. Gloves and an apron are to be worn. Droplet precautions are used for patients who have a meningococcal infection or influenza. A surgical mask is to be worn. Airborne precautions are for patients with TB, measles, chickenpox, or SARS. An N95 mask is to be worn.